Awesome. So thank you all so much for joining us today. We just wanted to do a quick little webinar, after over 10 years of fight and hitting the halls, the General Assembly, and talking to everybody for years and years and years about the importance of Medicaid expansion. It's a reality now. So we passed a bill this year, and I think everybody is as excited as we can be considering all the other stuff that's happening in the General Assembly. But this is something to celebrate, something that we've worked really hard for a long time. But I think there's still a lot of confusion is, we've passed this bill, but what happens now? What are we going to do now? When is this going to become a reality for folks in North Carolina, for the 600,000 folks who are going to be gaining Medicaid coverage through expansion? So we wanted to bring this together for our friend Han Nam Kung from the Justice Center to give us kind of an overview of what all's going on, how we got here, and kind of what to expect. And then we have John Fernari from NCDHHS to talk about what it specifically means for people who are living with HIV and a part of our HIV medication assistance program. So with that, we are going to let them talk for a few minutes, and then we figured we would give some time for question and answer. So if anybody has any questions or lingering thoughts after their presentation portion, we will have plenty of time for that. So without further ado, Han, I will knock it over to you, and the floor is yours.
Hi everyone. Good morning. Nice to have y'all on the panel and see everyone here. My name is Han Nam Kung and I'm with the Justice Center. And like Matt said, it took over 10 years for us to expand Medicaid and get to this point that we are here now. It's been a really long fight, but we're finally here and we're almost in the clear. So one really big thing about Medicaid expansion is that we do have to pass a budget in order for Medicaid expansion to go live. So right now, the Senate just recently released their budget, and they'll be taking votes on their budget today and most likely, very soon thereafter. And what happens next is that the Senate and the House, they go to something called conference, and they really figure out a compromise between their version of the budget, and they come together with a conference budget to present to the governor. So, depending on that timeline, we are thinking that the budget will be passed by mid-June, the end of June. So once that happens, the department will be able to submit in all of their paperwork and application to CMS and get that process approved. And I'm sure John will have a better idea of when that timeline is going to be for when Medicaid expansion goes live. But we're hearing, August-ish is when the program will go live. It's been years of, advocating. There's been so many advocacy days, years of Moral Mondays, so many people telling their stories of being in the coverage gap, what it's been like to be uninsured, many providers who have, gone to the General Assembly and talked to legislators about how heartbreaking it is for when their patients don't have health insurance. And it's just been a really difficult fight. In 2019, we had, 23 candlelight vigils that we held all across the state to honor the lives of people who had not made it because they were stuck in our state's coverage gap. And after that, we had a vigil with all of the states in the South for those Southern states that haven't expanded Medicaid. And we formed a coalition called the Southerners for Medicaid Expansion Coalition. And that coalition successfully lobbied for an extra incentive from the federal government to expand Medicaid. So that was helpful, and that brought down an extra $1.5 billion to North Carolina for when we do expand. So those are some of the things that we did to get us to this place. And some things that we're going to be looking for once expansion goes live is, having community events to help enroll people, looking at ways that we can make sure that communities hear about this program being available. There's going to be about 150,000 people that we're going to have to sign up that aren't already in the Medicaid rolls. So These are folks who are leaving prison and jails, people who may be houseless, people living with HIV, parents. And, we're just really excited about ways that we can be working together to make sure that everyone who is eligible for Medicaid is signing up and getting the care that they need and deserve. So I'll just turn it over to John because I know that there's going to be a Q&A part, and I think that's the most interactive and interesting part of the webinar.
Thank you. So I'm John Canari. I am the newly reappointed program manager for the HMAP program. I actually was with HMAP from 2009 to 2017, and I was part of some of the working groups that NCAN hosted very early around what can we do to make this work, to make this actually happen. So I'm super excited to be coming back on board at the time that Medicaid expansion is happening. This is something that I know a lot of people have been working really hard towards for a long time. And it is very exciting despite all the other things that are going on downtown at the moment. So with that, I'll give a brief update on the things that are going on here and how we're planning for what this will look like for people living with HIV who are currently on the HMAP program, and probably also I don't have a lot to say in terms of updates, but I know this is going to impact a lot of the clients on HMAP as well as clients who are receiving Ryan White Part B services as well. And those are some things that we're working towards identifying at the moment. So I don't have a lot more information about when this will actually happen. We are waiting to make sure the budget gets passed, and then we'll be dependent on Medicaid to get CMS approval. And once that happens, and actually before that even happens, staff have been working with case managers and agencies around the state. In fact, some folks may be hearing from staff in the HMAP program very soon to try to identify what is the process at the different agencies for moving clients onto Medicaid, because that is a bit of a, I don't want to say mystery, but it looks different at different places, and it's right now we're in the discovery phase of trying to figure out what all of the providers and case managers in the community that work with our clients, how they do that, what that process looks like, so that we can help facilitate that. The main thing I want to say is we have no intention of moving or kicking anybody off of HMAP or Ryan White Part B services immediately after Medicaid expansion occurs. I think in some states early on there was this idea of, okay, well, Medicaid expanded, that's great. Let us know how it works out. We are going to try very hard to make sure that everybody safely lands on Medicaid, stays in care, stays on medication. We're not interested in just throwing people off or ending eligibility for HMAP. At some point, HRSA will tell us that we will no longer be able to cover people who are eligible for Medicaid, but we're not expecting that to happen in the first year or possibly even into the second year. I think at this point, there's a lot more questions than there are answers, and we're still trying to figure out how do we safely and transition everybody onto Medicaid and keep them in care, which is our highest priority. We have a pretty high viral suppression rate for our population. We want to keep that, so we don't want people getting lost in the shuffle or feeling like they've been just let loose into this new system that they don't understand. And to be honest, it's not a system that me and my staff fully understand either, but that's kind of where we're at now. I think it's more important to hear questions and kind of have some dialogue here. So I'll stop giving an update unless anybody has questions at the moment.
It looks like there is one question in the chat that I'll raise. Is there an estimation of folks on HMAP who will become eligible for Medicaid expansion?
There is, and it's a pretty wide range because there's a lot of factors involved. Our income eligibility determination does not align exactly with what Medicaid is using for eligibility. So there's some variation there, as well as a couple other questions for trying to think of the correct term. Well, there's a couple other eligibility criteria that don't really align with the HMAP with the Right and White program. But generally speaking, we're thinking somewhere between half and 2/3 of the HMAP population could become eligible for Medicaid. I've got some questions about Medicare recipients and our SPAP enrollees and whether or not how many of them will be impacted. And I may actually reach out to Matt soon to get some help with some of those questions. So that's a very wide range and kind of a general idea, but that's where we're at the moment.
So I think we intended for this to kind of be more of a question and answer type of webinar, just because I think, as both Han and John have stated, we are very much kind of in an in-between right now. There's not a lot that we know. There's more that we don't know than what we know. But I think there is definitely some community advocacy that needs to happen. There's some just general knowledge that we need to kind of think through as a community to prepare everyone for this. So definitely want to open it up for questions. I know that one of the questions that I have that's kind of in front of mind for me is both for people who are living with HIV and for other people who are not. As the public health emergency starts unwinding, we know that we essentially have expanded Medicaid in North Carolina through the public health emergency, where people have gained coverage during the COVID-19 pandemic. So as that starts unwinding, what do we think the overlap is going to look like that from people rolling off until Medicaid expansion kind of takes off, since we do have a little bit of an in-between period? Do we have any kind of insight on that?
Matt, I can speak to that, although I don't have a lot of insight. So we haven't seen a huge shift in the HMAP population during the emergency. So I'm not expecting that a lot of our clients moved over to Medicaid, although there definitely are some. And we don't have a mechanism for, there's no like real mechanism for tracking that at the moment. I'm not sure that there's going to be an official mechanism as expansion occurs and we start to move people onto Medicaid. But me and my staff will be working on trying to keep track of who lands and where they land and how they landed. So I don't have any real numbers on how many people moved over to Medicaid during the emergency, but we are aware that this could be an issue. And it's just going to add to the churn, which is going to complicate the process for us, but also complicate the lives of our clients and people living with HIV and other people who are eligible for Medicaid. And it's an issue that we're aware of, but I'm not sure that we have all the answers at the moment.
I can chime in too. It's my understanding as well that for people who are losing certain types of Medicaid eligibility during this redetermination process, that they'll be shifted into the family planning Medicaid category, and that has a pretty high income eligibility threshold. So that's going to be helpful for the county DSSs and the department, because it's kind of less administrative work of having to contact people again and all of that. So folks can be in that category of Medicaid until we have Medicaid expansion and can move people over there. But it is like shifting people sort of like around here and there, so that there's just less. We're trying to have less administrative burden, I think, than trying to like fully remove people from Medicaid completely.
Yeah, and I will note for folks who are on the call who are not familiar with Medicaid family planning, PrEP services are included in Medicaid family planning. So that is a great place for us to continue to advocate for folks to be a part of who may be eligible for PrEP services, PrEP and PEP services. So just kind of a little insert there. Judith.
Hi, John, you mentioned that you all weren't planning to automatically enroll, or at least that's what I heard, automatically enroll people who would be eligible from HMAP to Medicaid or move them over automatically. Is it purely because of the hesitation of navigating a new system around getting medications approved and, having health insurance, or are there other factors that would, that creates an opportunity for advocates like ourselves to start creating some patient education around Medicaid?
That's a good question, Judith. So just to clarify, we're not planning on disenrolling anybody from the HMAP or Ryan White program. There's no mechanism for us to auto-enroll somebody onto Medicaid, so it's going to be, the responsibility is going to be back on the client and their case manager or provider to navigate onto Medicaid. And we're hoping to be able to facilitate that the best we can. As I said earlier, staff are starting to reach out to case management agencies and provider agencies to try to figure out the best practices for how does a client navigate onto Medicaid, and then once they're on Medicaid, how do they ensure that they're able to see their provider and they're able to stay on their medications and their regimen. So we want to be able to provide that information to folks so that they land safely and securely on Medicaid and stay in care.
Another question I have is a little bit outside of like once it becomes a reality and more of kind of the here and now. So as we kind of go into this budget negotiation process, and Han, this might be something that you can speak more to from your kind of advocacy lens, are there things that we need to look out for, and are there things that we need to, as advocates, be talking to our representatives about as we go into the budget negotiation process?
Oh gosh, how many landmines are there in the House and Senate budget? Wow. Where to begin? Oh gosh. Yeah, I'll have to think about that. I mean, we saw that, there was Senate Bill 20, there was a just devastating veto override on Tuesday. So a lot of people were thinking that bans on abortion access would be in the budget, but they didn't have to. The legislature doesn't have to do that because they do have supermajorities now in both chambers. And so certain things that I think that we were expecting there to be in the budget just aren't, because there was a member who changed parties recently. So there are supermajorities. There are, I think that if you talk to our colleagues in the public education space, we don't have enough funding for public education. The Leandro plan isn't being funded fully in the way that it should be, and in the way that the state is required to under our constitutional obligation to fully fund public education and make sure that every child has the right to a sound and basic education. That is not there. We are not, we could be doing a lot more for public school teachers and things like that. I think that, there's always more funding that we could be doing for mental and behavioral health. There's a lot. I think it's a lot of, what's not in the budget that that's disappointing. But to the to what extent can we try to get things inserted now? It's that ship has kind of sailed, and now it's going to be kind of duking it out over what's in there and coming to a compromise on those things. I think we'll have to look to the future to really think about, what are the funding priorities that we want for the next year and the year after that. And I think that those are always good conversations to, like, for us as advocates, we can be thinking about, what do we really want to see in the next years. But right now we'll just kind of see how conference goes. It's a very secretive process. It's closed doors, and we don't have access. The public doesn't have access to know how those negotiations happen, unfortunately. So, yeah.
I recognize that was a very lofty question to ask, but I felt like it was needed to be put into the room. And I'll ask one other question before, and other folks can hop in whenever. But this one's kind of for John. So I know one of the things that advocates are really appreciative of HMAP and Ryan White services are the wraparound services and outside of just traditional kind of healthcare coverage. So like transportation services, food insecurity services. For folks who are transitioning over to Medicaid from the HMAP program, are they going to still have access to those types of services? And if so, how is that going to look?
I wish I had an answer for you right now, Matt, but I don't. But it is something that is on our radar. I think until they are on Medicaid rolls, they will have access to everything that they have access to now. And then we are still in the discovery phase of trying to identify how our program will adapt to Medicaid expansion, what things we can or can't provide to clients or people living with HIV, and also what things will change for us as a result of having a lower number of enrollees on the HMAP and Ryan White program. That's definitely a possibility. Like I said, we've got a pretty wide range in terms of our estimates, but they're just estimates, and it's hard to know how quickly it'll happen and what the roles will look like when it ends. But I think once everybody's transitioned over, we have some ideas for what we can do different and what services we can tack on that will be available to clients who remain eligible and enrolled in Part B and Ryan White services and HMAP services.
So what I am hearing from that is there is an opportunity for us as advocates to talk to our representatives about the importance of the state funding that we get for HMAP to continue to fund those services as people roll over to Medicaid, to make sure that even for people who are not enrolled in Ryan White, that they still have access to services that are beneficial for people who are living with HIV outside of just general healthcare coverage. That's how I took that answer.
I would agree, and as a state employee, I have to be careful about my advice on advocacy work, but I'd be happy to talk to you offline, Matt, probably sooner than Advocacy Day, because I'm excited for the work that you all are doing, but I have some thoughts and some ideas, things that I want folks to kind of have on their mind, but probably not in this form.
Absolutely. All right, looks like we have a question in the chat from Adriana. If you were a case manager working with folks living with HIV, how would you talk with them about this change at this moment? What would be your several main points to try and convey?
So I can answer that. If we're talking about somebody who is on the HMAP program and is being served by UMAP, PCAP, ICAP, SPAP, or somebody on the Ryan White Part B program, I would say that for now, they shouldn't be worried about losing access to services, and they will, when they get onto Medicaid, will have access to a more robust variety of services, and that case managers and providers will hear more from us I think in the second half of the calendar year, as we gear up for seeing people actually transition onto Medicaid.
And another question from Aleda. Are you going to continue working only with Walgreens, or will clients have more pharmacy options through Medicaid?
So currently the UMAP program only works with Walgreens, and that's because of our purchasing agreements that are in place. So the state, the HMAP program is eligible for extremely deep discounts on medications, but it requires several contracts. We have a contract with a wholesaler that we purchase medications from, and then we also need to have a pretty limited contract with a pharmacy to distribute the medications that we purchase. So theoretically, when Medicaid is when Walgreens is dispensing that medication, they're dispensing the medication that the state purchases, or it's the state's medication. So we don't have the ability for the UMAP clients to have a very large network of pharmacies. But for our insurance coverage wraparound programs, SPAP, ICAP, and PCAP, we have a much broader pharmacy network for, essentially we will follow the primary insurance's pharmacy network. We'll work with any pharmacy in that network. But for the UMAP clients, the uninsured clients, we are limited. We've tried to make that network as large as we can, but we're limited in based on our purchasing agreements.
And a question from Beverly in the chat. It says, as you know, client eligibility can change from month to month, usually based on income, employed versus unemployed. I would assume you would be considering a process to check eligibility on a regular basis, maybe even quarterly, and potentially foresee clients having fluid eligibility for Medicaid based on hours worked, job changes, et cetera, that are more restricted than those of the income requirements. Ryan White.
That is true, and I think that will be one of the challenges that we'll have to work through is clients who become ineligible for Medicaid, like on a rolling basis. We'll see a little more churn, I think, in the Medicaid population, and they will need to become as agile as possible to try to get clients back onto HMAP or Ryan White services as needed. I do have an exciting announcement. It's not directly related to Medicaid, but the state has awarded a contract with a vendor for an electronic eligibility enrollment system. This is another thing that has been in the works for about 10 years, and it's work that I had started when I was with the program, and Jacqueline Kleinmore has really been the champion here in moving this forward, and we've just recently awarded the contract with the vendor. It will probably be at least a year before that system is up and running, but the vendor is in discussions with us now to build that system, and it will be very different and a lot more user-friendly than our current system. And the timing is good because we may see more clients churning between Medicaid and HMAP, and this will be a mechanism for making that a little easier.
So any other questions? I know we're about at the 30-minute mark, so want to be conscious of folks' time, but want to keep it open for questions if anybody has any others.
Can I ask a question if there are no questions from the audience? So we're, really thinking about enrollment, and we're going to be trying to get trained and join the North Carolina Navigator Consortium. And I'm just curious from the perspective of, it sounds like there's a lot of service providers, and perhaps they're really impacted folks here on the call. But as we are thinking about enrollment, sort of what do y'all think are like some specific or special considerations that we should have in mind as we're trying to enroll people living with HIV? And that question's for y'all.
Checking the chat to see if anybody has any thoughts in the chat. One of the things that I've continued to hear is just the support of case managers. I think that's just really just making sure the case managers are fully in the know and have the support of the Navigators Consortium. And as they're starting to enroll folks, just making sure that everybody is fully educated and aware. Judith, any thoughts from you?
Yeah, I was going to say that I think that the Ryan White program is the only public health benefit that exists regardless of your immigration status. And I think navigating, enrolling folks and making sure case managers know that there are some requirements based on legal status for Medicaid that do not necessarily apply for some of these other programs. So while somebody may be eligible based on income or household size or whatever, there are other things that may bar them from accessing that. There is, and I'm not actually quite sure if when you become a new US resident, if the bar that you have includes Medicaid. So I know it doesn't include like emergency Medicaid and some of these other services, but I'm not actually quite sure. So I think these are all things that we'll have to have really nuanced and very specific conversations with case managers, because of the differences in the programs, and that are not just about income, like Beverly mentioned, right, in her question.
Yeah, Judith, that's really important. And that's one of the things I was trying to get at before when I was talking about, eligibility doesn't align between HMAP and Medicaid. Um, Brian White and HMAP has a little more wiggle room in the sense of resident status and in a couple other areas. So we may not see everybody who appears eligible actually become eligible or move over. And it's a decision we made many years ago that I'm glad we made. We do not collect information on people's status for the purpose, because we don't want anybody having access to that information and using it against us or them. So, but it will also make identifying who is truly eligible a little trickier. So I think that is part of the wide gap in the range of our estimates.
Yeah, and having those conversations can be really sensitive, because if we haven't asked before, and then suddenly folks are being asked, may deter people from, trying to access services in the future. And I definitely think that there's going to be, from the advocate side, from folks who are case managers, folks who are doing some of this training in preparation, to keep all of these things really present.
Thanks. That's really helpful. And it's true. There are is really specific on the different kinds of immigration statuses that people need to have in order to qualify for Medicaid. Like there are a bunch of different statuses, but very, very specific. So thank you for those points.
All right, we'll do a last call for any other questions for anybody else on the line. I will say one other one that I am interested, that I'm interested in hearing about is, I think there's probably a concern for people who are living with HIV who are on HMAP and other services that are covered through Ryan White, around keeping their provider and making sure that they are able to see their trusted provider. Do we have any insight on that when it comes to expansion, as far as like, will we see a lot of shift between the current providers that folks are seeing?
So I think that's one of our big question marks, is we want to make sure that clients still have access to their provider and access to all their medications and stay in care. I don't have a whole lot of information at the moment, but that'll be one of the things we're looking into, and one of the reasons why we're going to be very careful, deliberate about how we do this. We're not going to just close the doors and say, okay, Medicaid's open, our doors are closed. We want to make sure people stay with us long enough to land safely and securely on Medicaid, whatever that looks like for them.
And with that, I mean, I will say we know that Medicaid is the longest and largest provider of coverage for people who are living with HIV in the country. So we know that the program is extremely beneficial and works really well at keeping people in care and virally suppressed. So, but these are all questions that, especially as a state that has not been able to do this in the past 10 years, that it's a growing pain that we're going to have to figure out together, and to really continue to keep our eyes on, to make sure that what is happening for people who are living with HIV is the best for them. So I really appreciate all of y'all's insight in this. And if there are no other questions, I will give y'all back 20 extra minutes of your day.
Aleda put a question in the chat, sorry.
Oh, I'm sorry, Aleda, I did not see that. I don't know if you mentioned about what happens if a client does not notify HMAP about their Medicaid approval. Will the pharmacies check if the client is covered by Medicaid before processing the claims against HMAP? Clients sometimes are not knowledgeable about their coverages independently of the education and information provided by their case managers. I'm asking because I would not like to see clients receiving bills from HMAP if this is not captured by Walgreens.
Yeah, that's a good question. That's something that's one of the things that is kind of keeping me up at night when I think about what this looks like. Is we're gonna make a concerted effort to move people carefully and thoughtfully, but people are gonna move on their own, and they're not gonna wait for they're not gonna wait to hear from the HMAP program. I think some will, but I think some will be very proactive, and some will just start to move. And I know there'll be a lot of enrollment events, and we want to make sure that when people move to Medicaid, that they let us know so that we can turn off their HMAP. The pharmacy should be checking, and the pharmacy will probably be our first line of defense in finding, hey, this person all of a sudden has Medicaid access. What do you want us to do with this claim? So we will have some checks and balances in there to find people that move, but it'll be really important, and it'll be part of the communication that we have with case managers and clients is, if you transition over to Medicaid, please let us know so that we know where you are and we don't think you're lost to care. We don't think you're just all of a sudden not filling prescriptions anymore.
Awesome. Okay, last call. Any others?
Yes. Hi, everyone. This is Jai. Um, I want to know if John knows when the electronic enrollment will begin.
I do not know. I do know that we awarded the contract, I want to say a week before last week. So we've had one conversation with the new vendor. They will have I want to say 90-day period to get up and running, and then they will have another period to build the system, and then there'll be testing. So I'm not expecting this to happen super quickly. But as we know more and as the timelines start to be created, I can start to share that with the community. I would say best case scenario in a year-ish, but don't hold me to that.
It's very exciting that it's happening. I know it has been in the works for quite a long time, so I'm glad that is becoming a reality, even if we have to wait a little bit longer.
Yes, and I have to say, when the opportunity to come back to the program emerged, I was like, what an amazing, awesome time to come back. We finally, and I told Jacqueline, I feel like I'm stealing her thunder because she's worked so hard on this since I've been gone to move these things, especially the eligibility system. And I'm just so happy about Medicaid expansion and how important that is to our clients. So I'm super excited to be coming back in as so many important things are happening.
Looks like Beverly dropped something in the chat. I'm wondering if you know if clients will be sent a monthly card as opposed to the old yearly card. I stated this could be problematic if clients based on income might be moving off and on the program.
Are you referring to the Medicaid card or card from HMAP?
Medicaid.
So I don't know what that will look like. But as we get closer and once this really is in the works, we will start to interface with our colleagues over at Medicaid, try to navigate that as well and try to get those answers.
I can answer that. It will be a yearly card. It won't be monthly. They only check your income eligibility for Medicaid once a year. So it's not, every quarter or anything like that. So even if your client has month-to-month income changes, that's fine because that redetermination is what it's called. Very wonky, but that only happens on an annual basis.
Okay. With that, That's great. Good to know. Yes, I agree in the chat. With that, if all, as my Southern Baptist roots say, if all hearts and minds are clear, I just want to say thank you to Hun and John for this I think it's a really important conversation. And I think these conversations are going to need to be had over and over again as we kind of move into this, just to make sure that our communities are fully aware and fully ready as this kind of rolls out. So huge appreciation to y'all. As I said, this is recorded, so we will make sure this is on our YouTube page for folks who are not able to join. Thanks to everybody who joined and asked questions. I think these are really important questions. And with that, y'all have a great rest of the Thursday, great rest of your week, and we look forward to seeing y'all all soon. Oh, and join us on May 31st for HIV Speaks on Jump Street if you are not registered yet. Link can be found in all of our bios of our website and social media and all that kind of stuff. So we hope to see you on the 31st at the General Assembly, and look forward to seeing everybody soon. Y'all have a great day.
Thank you.
Thank
You too.
you.